Hey guys, welcome back to my YouTube channel. I do want to apologize firsthand for taking so long to upload a video. I'm still going through the motion, going through the recovery process. I have been having quite a difficult time, only because just my sleeping habits, had to change. I wake up, as you can see, I'm still swollen, my arms swollen. Some of my body parts are um, still very much has a lot of swelling on it. Um, I do want to talk about firsthand my experience with Dr. Fisher and then my experience with Jolie, because it's two completely different topics, right? So my experience with Dr. Fisher, he is awesome. He made me laugh so much. He made me feel so comfortable. Um, he really made me feel like he cared. He made me feel like he cared. He made me feel like he was giving me the best, that he will give me the best results possible. He took his time. He took about a little over an hour with me, just talking to me, explaining everything to me as far as, what's to be expected uh, before the surgery and after surgery, and how I should be taking care of myself. Uh, he even, took it, he even took it upon himself to even show me some pictures of some of the things that he has been doing lately. I know that he has been traveling, so he shared those pictures with me, which made me feel, um, I would say, special. But I'm sure he does that with all of his patients. You could tell that it's in his nature to make for him to want to make his patients comfortable before his surgery. So, as soon as I got there, you have to fill out all of this paperwork. The two receptionists, um, as soon as I walked in, weren't the nicest. They had an attitude. That place was completely filled. And when I tell you, they had everyone all gathered together in a room, from people that just came in from the airport, their first time there filling out paperwork, all bunched together with girls that had just gotten surgery the day before. I personally didn't like that. I think that because you could be exposed to any type of infections. It was a huge like health concern for me. But and also scary because you don't know what to expect. So when you see all of these girls walking in and out with their drains hanging from their legs, their faja, some people may call it garment, with blood stains, they still look pale. They still look very much pale. They look like they're about to pass out. They look like they're in pain, and it really puts the fear of God in you. And that's something that I personally didn't think that we should, like, people firsthand that are just going into surgery should be exposed to. So I didn't really like that. Then when they took me, so I signed the paperwork, and I literally stood there for about an hour before I left. They took my vitals and everything. I will have to say that Dr. Fisher's assistant is hands down the best. She made me feel so comfortable. She made me smile. She made me relax. Um, I mean, I have her name somewhere, and I will share her name with you guys. But it was just she was just awesome. She really was. And what else can I say? So okay, so the following day, my surgery was scheduled to be at 1 p.m. and they had called me in to come in quite a bit earlier. So I was already on my way. I was maybe about half an hour already earlier than I was supposed to. So I had gotten there. They take me to the back room. And another thing that I didn't like, that I will say, is the waiting room areas are right next to the recovery rooms. So you hear, the girls just waking up, you hear them crying, you hear them in pain. Um, and it's just very scary. It's very scary, and I wish if they could have changed that. I wish that was one thing that they would change. But anyways, I get taken back to the back room. I was being told that the girl that was supposed to get surgery before me, very high blood pressure, and they also had a girl that um, her pregnancy test came back positive, because they do take before surgery, right before surgery, they take a pregnancy test and a drug test. And so I guess I just happened to be lucky, because I heard that once they take you into the back room, sometimes it may be hours before Dr. Fisher even comes in to talk to you. But long story short, the girl that took care of me was like, oh, if it's one thing that I will ask is, please don't wake up, screaming or yelling, because the nurses are gonna get very annoyed. And in her own words, she just tried to insinuate that there was no need for it, to relax, to just ask for help. So I didn't want to be that girl, because I got the notion that if I do wake up in pain and screaming, like I was hearing some of the other girls do, that they weren't going to be so hands-on with me. So I kind of went into surgery with that mindset, like, Laura, as soon as you open up your eyes, suck it up and just be very polite and just ask, for medicine or whatever, pain medicine, whatever it is that you need to be able, so that they could help you. So I stood there in the back room, maybe um, I would say about 2 hours, an hour talking with Dr. Fisher. Um, and then it was literally like 15 minutes later, when they were like, okay, come on, we got to roll you um, into the surgery room. So when I walked in there, oh my goodness, it was freezing cold in that room. And, they asked me to lay down on the table. They put my IV on me. They were like, okay, you're going to go to sleep. I couldn't tell you what happened after like 30 seconds. I woke up. I didn't wake up freezing cold, shivering, but I did wake up in pain. I wouldn't necessarily say the pain was out of this world where I thought I was going to die, but it was still very much painful. So I kindly asked the nurse, like I said, I woke up with the mindset where, like, you cannot scream and you cannot yell, right? So, I politely called her over. I was like, Miss, she heard me, and she came over, and I was like, I'm sorry to bother you. Can you please give me something for the pain? I'm in a lot of pain. And she was like, okay, no problem. She went, got whatever it is that she needed to get, came back literally a minute after. And whatever she gave me really helped. I must have been from the time that I woke up to the time I left, I probably must have been in the recovery room for maybe less than an hour. One thing that I do want to touch base on is I didn't get the cell saver. According to Dr. Fisher, he told me I was the first patient that didn't get the cell saver, but I did see another video of another girl that also said that she didn't get the cell saver. So what the cell saver is, it's supposed to be just, it's like a blood transfusion, because you do lose a lot of blood, and it's supposed to help you with the recovery process. It's supposed to help you feel better, and the healing process is supposed to be a little bit more tolerable and pleasant. I didn't feel the need like I had to. My blood results came back, beautiful. I was just like, no, my body's just gonna recover just fine. I don't want to have to spend 600 and something dollars and some change. Dr. Fisher didn't spend too much time trying to lecture me on why I should get it. I think he also saw that with my blood work, the results with my blood work, that I was going to be okay. But he did, stress the fact that it's a good idea for you to get it, just simply because, again, you lose a lot of blood and it doesn't make you feel as weak. But I didn't get it. My worst days were the fourth and I'm sorry, the third and fourth day. Those were my worst days. I literally wanted to die. I thought I wasn't going to make it. I didn't have an appetite. I had to force myself to eat. I didn't want to drink water. It was just, a disaster. I was crying the whole time. I felt like I was depressed. I was questioning why I did, my surgery. But my friend that came with me, she had a BBL done a couple of years ago, and she told me that once that fifth day hit, that it was going to be like holy grail. Like you're gonna wake up feeling so much better. The pain is gonna subside so much, and that's exactly what happened. Once that fifth day hit, at least for me, I was already walking. I was beginning to have some sort of appetite. I was eating, and I was in a better shape. Also, I think what also helped me was the massages. I got my massages with my Body Contour 305 with Yadi, and I have to tell you that I don't know. In my heart, I believe that the reason why um, I didn't have as much swelling in the beginning was because of those massages. Um, I wouldn't recommend you going into surgery without also adding the massages, into account. I feel like the massages again just helps you, with your skin. It helps the swelling. It helps the pain, and it just makes you feel so much better. It's so hard for me to explain because this is something that you really have to go through in order for you to understand. But just know that, hands down, I don't know what I would have done if I wouldn't have booked those massages, because I really do feel in my heart that the reason why I'm able to even move around now, or within the first week, was because of the massages. But if you guys have any questions, I don't want to make this video too long. I'm just thinking off the top of my head, of my head, some of the topics um, that I should cover with you, but I think I covered, the main parts. If you guys have any questions, please. There's so many girls that have reached out to me through Instagram. So many girls that have reached out to me through YouTube too, as well, sending me private messages. Please feel free to reach out to me. I try to get back to you ASAP, because I know how it's like. But I'm gonna go ahead and show you my results with my faja on. Once I take the drain out that first week, they recommend for you not to get any massages for the next week or so. So I didn't. I'm actually going to start my massages again. I found this really good lady that someone recommended me to her. Tomorrow at 9 a.m. will be my first session after the drain was removed. But anyways, so again, I am almost 3 weeks post-op. I will be 3 weeks exactly 2 days from now. So these are my results after I'm sorry. These are my results 3 weeks post-op. So just give me just 1 second while I go ahead and get changed and show you guys. Okay, guys. So here you have it. This wasn't the faja given to me by Jolie. They gave me a black one, which was already way too big on me. And I was using the foam boards. I do also want to make sure that you guys are aware that Dr. Fisher did advise for me not to use any foam board or hardboard. He said it's completely unnecessary. He doesn't recommend it. It doesn't really make a difference according to him. He was just like, just make sure that you're eating, but don't overeat. He was like, I don't even recommend you go into the gym. Again, if you're careful with your eating habits, your body should still remain intact. So I stopped using the foam boards about a week ago because it was just too much of a hassle. Me personally, I couldn't handle it. But I am using a hardboard only because I don't have it on right now. But I am using it only because um, it helps me sit straight. It helps me with my back. It forces me um, not to slouch or uh, or hurt my back even more. So because it's so big, it's like a huge circle. It kind of forces me to have a better posture. But back to this, as you can see, um, these are my results. When I went in, I was about 156 pounds. I haven't weighed myself, but I do have to tell you that I have no stomach whatsoever, no back fat. He injected a lot of fat on my hips and also on my back. So between the two, my two sides, he put 1,500 on one side and 1,500 on the other. He didn't say how much he put on my hips, but I'm sure it was all combined together. So he put a total of 3,000 cc's of fat between both my butt cheeks. So again, I do want to make sure that you guys know that I do still have a lot of swelling. So I'm gonna go ahead and turn around. So this is my waist, right? And this is my butt, which I had, guys, I had nothing. Literally had nothing. So when I say that I am just so happy with my results, I really am, right? And I'm gonna go ahead and turn around. I had literally nothing, to the point where, like, when I saw myself in the mirror, I almost cried because I was just so, and I still am so happy with my results. So and look at my hips. Like, I did have hips. I'm not, I did have hips, but he just made sure that he gave me a nice hourglass shape and that it wasn't too much or too over the top. So I'm gonna go ahead and take some of my faja off to show you guys a little bit more. Not fully because it still pains me just to pull it up. But I already went two sizes down with my faja. But let me go ahead and show you just 1 second. Okay, guys, so here it is. Okay, so here it is. As you can see, look, I'm just standing straight. I have a marble on my belly button. Dr. Fisher recommended I get one only because he said I was gonna have a little bit of loose skin, so I kind of keep it in there. That's why I have tape all over. I still have quite a bit of swelling, which the lady that is going to go ahead and do my massages told me that I still have, which is normal. I'm only 3 weeks post-op. But as you can see, I have like a nice hourglass shape. It looks even better when I take my faja completely off, but like I said, it's just a struggle. I'm going to go ahead and turn to the side. You see, no fat, nice and flat. And here's my back. And here's my side. But my stomach is completely flat. I've never had my stomach this flat. But it's just pretty much it, guys. Let me put my faja on because it feels so weird to be without it. Just 1 second. Okay, guys, I'm back. So as you can see, this is the hardboard. So this helps me, again, to stand straight. It's totally up to you. Again, Dr. Fisher did say that there's no need for it, that he doesn't recommend it, that he doesn't understand why people use foam boards or hardboards. I do want to show you this triangle. They do make, they give it to you before you leave the facility. So you're supposed to put this underneath your garment for it to fall right here to give you that nice dent in the back. So this hump right here. I try to put it as much as I can, but sometimes I do forget. It's definitely not uncomfortable or anything like that, but I think I'm supposed to wear it for 6 weeks or 3 weeks. I'm not sure. But I just wanted to show you guys the importance of this because I do think that this has helped shape my back tremendously. Other than that, guys, I see I'm already 20 minutes in. I was hoping this video will be a lot shorter, but if you do have any questions or anything like that, please feel free to reach out to me. Um, by the way, if you guys do ask, my boobs are not fake. They're 100% real. I did not get those done. I'm sure I will get them done, you know, eventually if I need it in the future for whatever reason. But, you know, these are mine. Just have a feeling that question may come up. But anyways, thank you guys for watching. I hope that the information I gave you, you guys can use it to your knowledge and, you know, help you decide which doctor you want to go to. Again, Dr. Fisher, hands down, did an excellent job. His medical assistant, which is, you know, it's a lady with blonde hair, very light eyes. She's awesome. I will remember her name. I will. But I don't know it at the top of my head. So his staff, because he has his own staff that reports to him, they're all great. But Jolie itself, I didn't have, again, the best experience. But it wasn't the most terrible one either. So, you know, I guess I expected it. But anyways, thank you guys so much for watching. I'll go ahead and post another video maybe 3 or 4 weeks down the road just so that you guys can see my progress. Okay, we'll talk soon.